I'm sure some of you guys have experienced this, right? Like where, well, first of all, I don't know how many of y'all have had a positive screening before. I have, and the folks that I roll with have had positive screenings, right? But like, have you ever experienced a screening where you're sitting there and the provider, or not, it's not ever the doctor or the nurse practitioner that does the screening, but it's typically like the person that sets the stage for the provider before they come in. They do that screening. And that screening can be done like they might hand you an iPad, or they might be sitting there looking at your chart and clicking around and asking you questions, or they might hand you a crusty piece of paper. Whatever. It is what it is. But before asking those questions, first of all, it typically starts with an apology, right? Like they're typically I typically what I experience is this. It's like, sorry, I have to ask you these questions. We have to ask everybody these questions. And then they start with the screening, or like they hand you the paper after that, or whatever, like afraid to offend you. But like, think about the type of signal that sends to the patient. Like, you roll up and immediately you're apologizing to me and saying that you're only performing this screening because you have to, and you're saying that you give this screening to everybody. Like that's supposed to make me feel better or set the stage for me to be honest. I don't know, but yeah, I've seen it a million times. And that's probably why folks know that navigating health outside of the hospital and outside of the doctor's office, which is where the majority of your health experience takes place, is not easy. And we like to assume that there is support available for the folks that we serve. I would like to take it a step further, at least in my community, and partner with organizations, partner with providers, partner with whomever I need to partner with in order to actually like map out our community resources, map out our eligibility, and compare them to case studies or edge cases where folks have to navigate the system or navigate resource lists or navigate websites or whatever, and see what we come up with. Because assuming that support is there for these folks isn't enough. And I think there are consequences to these assumptions as well. And then, so not only that, not only do I want to map them out, and not only do I want to make it to where it's easy for it's easy for patients who actually postpartum patients, you know what I mean, or pregnant patients to have a clear vision or have a clear line of sight as to like what their resources are and when, so that they can make an informed decision as to how to handle their situation and how to self-manage their situation before as things escalate to having to go to the ED and begging the ED to navigate the situation for them, even though the ED is not going to navigate the situation for you, boo. It don't. I mean, our EDs have the best intentions, but that's not what EDs are for. You know what I'm saying? Like, that's not what EDs are for. And on top of that, like, we would like to assume that receiving care that we're eligible for is as simple as calling the number on the back of the insurance card, or going onto the public health website, or going onto the Medicaid website, or whatever. I I think again, it's really, really important for folks to challenge that, challenge the status quo, challenge perceptions of the ease of navigating lists like that, and then on top of it, do a mental exercise, right? Like, add on top of that stress, add on top of that infection, add on top of that sleep deprivation, which every postpartum person deals with sleep deprivation, regardless of the outcome of your pregnancy. Just saying. But layer on real world, real life stuff. Reality. Let's say that. Yeah. Layer on reality on top of that. And then ask yourself, are our support systems, or does our support actually support folks? Does our support actually support folks? Yeah. I came across a lot of this when I was doing work in non-compliance, right? Actually, you know what? That's going to end up being another video. I'll share a little bit with you guys about my experience holding workshops on patient non-compliance, and the experiences that we glean from there. It's easy to label a patient complicated. It's easy to label a patient non-compliant. It's easy to assume that a patient is just not adherent to treatment plans, or that a patient is lazy and this, that, or another, right? But when it comes to actually supporting folks, I think there's a level of accountability that we need to explore. And when I say that, I mean, like, we hand a patient off to a care coordinator. We hand a patient off to a community health worker. That's what I heard nationally. We don't really have very many here locally. But is there a feedback loop that informs you of how that handoff went, or how that delegation went? Like, how do we know that after that handoff takes place, after that referral was put in, how do we know if the patient's needs were actually met? Anyway, I digress. Bye.